Hi, as promised in my last video, I'm going to be shedding a light on why Black women in particular are affected by fibroids more than any other group of people. My name is Dr. Ipeleng and I make videos about women's health. So if this is something that you're interested in, go ahead and click on the subscribe button. You'll be surprised, or maybe not, to learn that Black women are 3 times more likely to develop fibroids. They also develop fibroids 10 years earlier than their white counterparts. Also, when Black women develop fibroids, they're usually larger and numerous. And all over the world, the number of hysterectomies that are performed are mainly performed on Black women. A hysterectomy is an operation where the uterus is partially or completely removed. And the main reason why women have hysterectomies is because of fibroids. Although fibroids are almost never cancerous, the symptoms can be devastating. There is a few general patterns in women who develop fibroids. First of all, genes and hormones play a role in who develops fibroids. Also, if they run in your family, if you're overweight, and if you eat too much red meat or ham. According to research, women diagnosed with fibroids are more likely to develop depression and anxiety. It is not clear why that is, and also which comes first. The disparity that we find in the development of fibroids can be partly influenced by the following factors. Number one, chronic stress. This is stress that lasts a long time. For a long time, chronic stress has been linked to a lot of health conditions, and fibroids is not an exception. This can include stress from racism. There is no proof that racism causes fibroids, but there has been some researches that were done and some epidemiologic data that actually says there is an association between racism and exposure to racism rather and the development of fibroids. There is another study that was performed where they compared the uterine fibroid tissue of the white American woman, the Japanese woman, and the African American woman. The biggest difference that was found was between the African American woman and the Japanese woman. It was found that the fibroid tissue of the African American woman produced or contained more estrogen than that of the Japanese woman. So it's plausible that chronic stress increases estrogen production in the human body or even in the fibroid. Number two is exposure to phthalates. These are chemicals that are found in a lot of products, but mainly in cream hair relaxers or chemical hair straighteners, which are used by Black women more than any other group of people. It was found that people who use chemical relaxers are 17% more likely to develop fibroids than people who do not use cream relaxers at all. And also the frequency of using chemical relaxers. People who use relaxers more every year increased their risk of developing fibroids. The third factor that contributes to the development of fibroids in Black women is a mutation called MED12. About 70% of fibroids has been linked to this mutation. This is a mutation that happens in the cells of the myometrium, which is the muscle of the uterus. Every month, the second half of the menstrual cycle, when the cells of the myometrium multiply in preparation for pregnancy, it is possible that this mutation is common in women of African ancestry, sub-Saharan Africa in particular, for reasons that are really not known. As common as fibroids are, there is not a lot of research dedicated to uterine fibroids. There are some researches that are being done, but there is a lot of information that is still missing when it comes to fibroids. Since there is no known cause of fibroids, it's very hard to give clear strategies on how to prevent fibroids. But if you have a hereditary risk, and if your menses started early, that means from maybe 9 years or 10 years or 11 years, there's a few things that you can do to prevent fibroids. First of all, making sure that you watch your weight, exercising and eating healthy, eating less red meat and focusing on a Mediterranean diet, which is eating vegetables, whether green vegetables, whether raw or cooked, lowering your alcohol consumption, keeping your blood pressure controlled or low, and also vitamin D. There is a research that was done that found that people who took vitamin D who had fibroids, the fibroids actually shrinked. It's a study that was done, I think, in 2019. So, making sure that your vitamin D is on the normal levels, or even taking supplements if you are a Black person, especially living in the diaspora where we have very less exposure to sunlight. That is all for today. You can put your comments down in the comment section, and I'll be more than happy to answer some of your questions if I can. And I'll see you in my next video. Thank you very much. Bye.